This is the important area where when we evaluate the red flags, now we already mentioned some red flags. Sometimes we have to ask the patient in their language, which because when the patient says that this is the worst headache I have had in my life, never had this kind of headache, you have to take it seriously. We have already mentioned about temporal arteritis or about this systemic meningitis encephalitis like thing. If there is a focal neurological sign or symptom, sometimes patients have slurring of speech or weakness of hands along with headache. Think about mass lesion or some stroke or whatever. Papilledema, if there is a visual disturbance, yes, somebody has to go for this fundoscopy. And you know that apart from malignant hypertension, if there is something inside the brain, they can have this problem. So in these patients, I have written also possible workup and will come to the investigation later on. So most of these patients needs neuroimaging. Sometimes patients, they have headache following head injury. Sometimes it's not the headache following straight away after head injury. It can happen after some time. And in this group of patients, if they lose their consciousness, say 3 days or had a fall or something, think about subdural or hematoma or epidural hematoma. Even post-traumatic headache, that can last for some time. Even with a whiplash injury, they can have headache. So whether these patients need some neuroimaging of the brain or they can need some skull x-ray or spine x-ray. It all depends on the presentation. So unless you see the patient, examine the patient, it's very difficult for you to say that whether this patient needs any investigation. If the headache is triggered by cough or this, we have mentioned that this thunderclap thing, headache with change in personality, this is important, that it's a chronic headache which is causing some personality or behavioral problem or level of consciousness. Think about some CNS infection or some mass lesion, brain tumor can present like this. So think about that. Pregnancy and postpartum period. So they have typical some special cases like this, apart from preeclampsia, eclampsia, cortical vein or sinus thrombosis, it can happen later part of the pregnancy, not in the first trimester, after first trimester. And also, if it is a nagging pain, but there's a worsening pattern, then think about medication overuse headache, think about mass lesion, think about subdural hematoma. Or new headache type of pain with, say, cancer and HIV, I have mentioned that you have to think about this metastasis or any opportunistic infection there in the brain.